Dr. Most right now.
Back at the Big 89, WLS. Dr. Kevin Most joins us now. For years, America's #1 source for medical information. You think I'm kidding? There's nobody better. Nobody better.
I agree.
Than bringing you medical
best.
information, explaining it to you in a non-condescending way, and talking about the stuff that matters. Good morning, Dr. Most.
Good morning. How are you guys? AD, good to hear your voice.
You too, Dr. Most.
By the way, Doc, we don't do politics in your segment, but I'm interested in your thoughts on this. If there's a third-party candidate, someone who seems to, hasn't declared for president, but somebody out there who seems to be fighting for the right things in medicine, we're going to talk about drug costs in a second and all of that. Is there anybody that jumps to mind?
No, I mean, there's a few that jump, obviously, the opposite side, and I won't go into that, but certainly when, third-party candidates, if they're going to stand on the medical side as their platform, they're going to have a tough time. There's obviously many other issues that are going to be more concerning to the voters, but certainly I would hope that any of the candidates at least look at some of the things that are really important to healthcare, whether it be vaccine availability, cost of medications, availability of just healthcare across this country at a equal or somewhat equal basis. We have healthcare disparities across this country that are very disturbing.
100%. And we'll continue with that question of the day. You can chime in on Facebook and also text in your answers. Condoleezza Rice, Pat Brady, both brought up here, Tulsi Gabbard, and Chris Elliott, who, if you don't know Chris Elliott from the old Letterman show, Chris Elliott, who played the mayor in the town on Schitt's Creek.
Yeah. Yeah.
I don't think he's qualified. But then again, qualified. Who knows? All right, so Dr. Most, let's talk about drug prices for a second. One of these potential independent candidates, Joe Manchin's daughter, is a bigwig in the drug business, but it would seem to me this would be something that would certainly ring the bell of older folks in particular. You talked about shortages, but prices are crazy high. What can we do as people outside of voting for people that get it, and how do we identify people that get it?
Well, if you look at drug prices, it's just an amazing. I mean, okay, take the United States and you go across to Canada, and I can get the exact same drug in Canada for 50% less. And it's like, wait, this doesn't make sense. Why is this? You could say that if our cost, if compared to most other established countries, we pay 2 to 4 times the amount that they pay. You say, well, how is that? And it's like, well, we allowed it to happen. What did we do? 1997, we allowed drug companies to start marketing directly to consumers. You can't watch a TV show without seeing a drug commercial, right?
True story, yeah.
Right.
United States and New Zealand are the only countries in the world that allow that to occur. How about it?
Is that right?
Unreal.
Just us in New Zealand?
Yep.
That's unbelievable. So are there safe places to go, like these websites like rx.com, where you can compare prices on certain drugs?
You talking GoodRx, rx.com, all those?
Yeah.
Yeah. Cost Plus Drugs, Mark Cuban's company, even Costco. I mean, there's a lot of places where you can at least decrease that cost a little bit and get the best. But we're still way behind the 8 ball. Countries with socialized medicine, they have a single payer. They go to the pharmaceutical companies and they say, we are going to pay this or we're not going to take your drug. Mm-hmm. So they have to roll over. Here in the United States, we are so fragmented. There's 50 insurance companies. You have Medicare, you've got Medicaid, you've got the states, we do not have any power over these guys because we also said that in the United States as of 2003, Medicare can't negotiate prices. Now that changes in 26. Finally, we get to a point where Medicare is going to be able to go and negotiate pricing back again. But we have kind of set this up. Compensation and consolidation. You look at how many drug companies have bought out these little drug companies. So we used to have 10 companies making generic amoxicillin. Now it's down to 2. Well, what happens when that happens? The price goes up.
Right.
So we have allowed a lot of this to occur, based on our own missteps.
So you have to find candidates who are going to fight for this, but a lot of these candidates, look, lobbying happens. Lobbying happens. And a lot of these candidates may be getting money from the big drug companies or various associated partners, insurance companies, whatever the case may be. And their incentive to fight hard to take costs down is not there. So what do you tell people to do?
Correct. I mean, you do have to look at that. You look at the lobbying for not only pharmaceutical industry, which is huge. You look at the lobbying for even grocery stores, drug stores, insurance companies. We have a tough time. How do you make sure that your candidate or your person is listening to that? We have to get to a point where we are allowed to pay close to what's paid everywhere else in the world. The burden of new drugs should not be on the backs of the American citizens. Unfortunately, it certainly is right now.
You mentioned Canada. Canada's price is half of what we have. It's all legal and everything to get drugs from Canada, and should we, or is that a risky thing?
Well, it's kind of a risky thing. I'm not sure exactly what the state laws are state to state. There are some states that I can't call in a prescription for a patient of mine, but most states, they allow my license is for the state of Illinois. I have a license in North Carolina, a license in Maryland, but my license is to practice medicine in the state of Illinois. So can I write prescriptions and say, go to Canada? People can still get those prescriptions filled in Canada. And again, why are Canadian prices so low? They have socialized medicine.
Right.
There's a single payer system up there.
Right.
That's why the pharmaceutical drugs are so inexpensive there.
Andre, you were going to say.
Why is it so hard to find generic medicines for certain drugs?
Yeah. So what happened there was, again, the consolidation side, right? If you had a bunch of small companies, these small pharmaceutical companies were making generics. Mm-hmm. Well, a big company might say, hey, you know what, we're going to buy you because we make the same drug you do. We can buy you, and now we'll make it more efficient for us. Well, you might make it more efficient for you as a company to make it more efficiently from a cost point of view. But unfortunately, you now say, well, now our competition's not there, so we're going to increase that. So things like that happen. It's like, oh, okay. But what happens when something bad happens to that? What happens when a hurricane hit the pharmaceutical company down in the South? And all of a sudden it's like, wait, we can't even get basic amoxicillin, a drug that, and when we can't get that, what do? We have to go to the more expensive cephalosporins. So when you're down to a single place or a single generic manufacturer, and some of them outside of this country, some in India, the next thing you know, if there's something bad that happens, whether it's employee unrest, whether it's a natural disaster, whether it's a supply chain issue, all of a sudden the simple generic drugs you can't find. And when that happens, you now have to go to a branded drug, which is often 3, 4, 5, 10 times the cost.
So you would highly recommend, as a Band-Aid in the short term, trying out the Cost Plus or Costco, if you haven't looked at Costco, or the Good RX. Or what was the other one you mentioned?
Cost Plus drugs.
Cost Plus, and you had an RX one, I think, too.
RX.com, right?
Yeah. Those are all legit.
They are all legit because what they have done, it's very interesting how they work. So these are apps mainly, or companies that have apps, and they do ads, so they get some money there. They'll get you into their regular plan and say, oh, if you want our gold plan, you could be a subscriber and pay more. And then they get referral fees. So if they send people to Walgreens or CVS or wherever, Walgreens gets them a little bit of a cutback because Walgreens is now fighting for that consumer as well, because a lot of people are going to mail-in. So now these bricks and mortar stores, which expects foot traffic, is going to do anything. And they're willing to pay Good RX $1.50 for every person who walks in the door with one of their coupons. So it'll be very interesting to see how it all shakes out. But pharmaceuticals, and as we age as a country, the number of drugs that people are on is just going up dramatically. I mean, the amount of our GDP that is spent on drugs is creeping up every year, and even just a simple percentage point is billions of dollars.
When we come back, a preview of a longer discussion on Accutane, and you may be having that ring around your head because you've got a kid that needs it, or maybe an adult. In addition to that, your cough won't go away. And what are the most Google-searched health questions by state? Oh, boy, well, I look forward to that. It's Dr. Kevin Most, America's Doctor. On 312-591-8900. A lot of folks can't seem to kick this cough. The symptoms of the cold or whatever other they had attached to it seem to go away, but the cough lingers. What do you know about that?
Yeah, Steve, it's interesting. Anytime you have an upper respiratory infection, you will have a lingering cough for at least some portion of time, whether it's, I feel great, I just had this cough, whether it's for 5 days, 6 days, 4 months, it can go on. And what it is, it's not the infection continuing, because people often go back, I need another course of antibiotics. No, you don't. For one thing, you probably didn't need the first course. It was probably a virus. The second is the bacteria that you would have had for bronchitis has been treated. What happens is our lungs and our more appropriately, our trachea is inflamed. And that inflammation causes us to cough. Cough's a defense mechanism. It's keeping things out of our lungs. People don't die from bronchitis, but they certainly die from pneumonia. And the cough is what keeps the junk out of our lungs. So the body is trying to help us defend itself as much as it can. And sometimes it gets hypersensitive and will continue to cause that cough from happening.
Sometimes.
Go ahead, Ellen.
No, Kevin, I was just going to say that sometimes that cough happens at night a lot. Would you recommend like a Robitussin or a NyQuil, or should you stay away from those medicines because obviously then you become reliant on those too much?
Well, you make a very good point. And people say, why is it worse at night? And there's a couple reasons. One is if you continue to have secretions, they land on the back of your throat. The throat says, I don't like anything here that's going to end up in my lungs, so I cough. So it's more positional. It's not that it's dark out. It's that you're laying down and now you're starting to have that drain. The Robitussin of the world are expectorants, right? Straight Robitussin is guaifenesin. It's an expectorant. It makes it easier for you to cough that up. Now, I would say, boy, at that point, if you don't have a lot of drainage, then I would be looking more at antihistamines to kind of dry things up a little bit instead of trying to loosen up. If you have congestion in your sinuses still and you're still coughing up productive stuff, then certainly Robitussin is going to help that to thin it out and make it easier for you to cough stuff up.
All right, but in the meantime, sleep in a chair or sleep propped up as much as you can for a couple of nights to let your body catch up to fight it itself is what I'm hearing.
Yeah, and if it's really bothering you, go and see a doctor because, steroids, anti-inflammatories are going to be more appropriate than antibiotics.
Google has revealed all of America's states' most searched medical issues. Now, as I fly through these, keep in mind, these are the ones in these states that are asked the most often. Through Google, all of your state's most searched medical issues, in general, bronchitis and lupus, and how much water should I drink every day? Is strep throat contagious? What causes high blood pressure? It's all in there. But again, to fly through these, Alabama and Alaska both want to know how they got monkeypox.
No.
Arizona says, how do you relieve bloating? I guess if you're in Arizona, less Mexican food, Doc?
Yeah. It is kind of interesting when you look at these questions by the state. And if people understand, when we were starting to track influenza, we used Google. We used Google Flu a lot because the states would tell us, we'd look for people when the states started or areas started getting high, what are the flu symptoms? How do I treat a fever? They would test higher 2 weeks later as we tracked the testing. So some of these are actually fun.
So this is forensic Googling.
Great. But some of them show the health illiteracy of the state, or some, like you just said, the dietary intake of some of these states. So,
bloating, lots of water, less salt, I assume?
Yeah, and it's interesting in Arizona for that, right? It's a state that I would be more concerned about dehydration than, overhydration. So certainly an interesting one there.
Arkansas wants to know what causes hemorrhoids. Could be living there.
No.
California, one of their main questions, why do I pee when I sneeze? Yeah, that's in California. Georgia, how do I treat all these ingrown toenails?
Oh, gross.
Idaho, how much caffeine's too much? Do you know if you're drinking too much caffeine? Is it when you shake all day, Doc? What do we know there?
Yeah, you have sleeping disorders. But, the California one was kind of interesting to me. I thought that would be more in Florida because as people age, their bladder control gets a little bit worse. So sneezing and losing a little bit of urine goes with an older population. I think of California as, young surfers and, people that are pretty healthy. So kind of surprising that wasn't a question.
Yeah, people that are peeing their Speedos. Right. This is interesting to me. Kansas, what does ringworm look like? I don't even want to know the answer. Oh. Iowa, what is a pap smear?
Stop.
Let's see. Missouri, how long can you go without sleep? What do you have in mind? New York, why are my gums swollen? Ohio, can you die of a broken heart?
Oh.
I guess that's something we've seen recently. Pennsylvania, is rainwater safe to drink? Go inside, Ezekiel. I know you're Amish, but get inside a barn. Texas wants to know how long you should shower for. Utah, how do I get rid of this dandruff? But closer to home, in Indiana, they want to know, let's see, what's a bunion? Why am I always hungry? And how do I get rid of the gas pain?
Oh, my gosh.
But bringing it home to Illinois, Doc, here we go. Can you live without a spleen?
How? You know what? How about it? Yes, you absolutely can live without a spleen. So individuals who are in car accidents sometimes will get a ruptured spleen, and we take your spleen out. Now, individuals that do have their spleen taken out, they have to understand that that's part of our immune system. So we're going to make sure that you're vaccinated for everything, especially pneumonia, because that's part of the way that we protect our immune system. The spleen's kind of a nice filter for us, takes out old red blood cells and does good things. But you can live without a spleen. So, yes, that is possible.
See, we're asking the tough questions here in Illinois.
Well, along with this one, Andre, you've asked us about me when I come into work in the morning.
Oh, no.
Why do I drool when I sleep?
See?
One of the top Googled questions in Illinois.
It's a good question.
Yeah, I mean, your mouth is going to continue to produce, moisture, especially if you're a mouth breather. And if you're not swallowing that has to go somewhere. So it's either going to go down the back of your throat or it's going to go onto your pillow. So drooling is just keeping the inside of your mouth moisturized, and it's a natural thing that we do.
Now, when you do it during the show, that's going to be my next Google question.
Yes. Management has asked that of me many times. And Doc, this one, we'll leave you on this one. This is from Kentucky. There's many reasons to worry about Kentucky, one of which is they're one of their most Googled medical questions. Can you live without a spine?
No, that is not in there.
Not making it up.
Come on.
Not making it up.
When you talk about health illiteracy, it's very sad that somebody would even have that question. I mean, I think you're probably learning somewhat of basic anatomy in third or fourth grade. And if you don't know about the importance of a spine and what it does, man.
If you're an amoeba, you can.
Well, what if you got like one of those uncles that always criticize, you spineless little weasel.
This
is why your mom and dad don't like you. What if you got that guy in your family?
Yeah, okay, but that's one person. You're saying that this is a highly Googled question.
Yeah, that's a good point. Yeah, that's a good point.
Oh, it's bad.
This is not the most odd one. This is one that is odd.
Yeah, that's true. That's true. See, that's why that's pretty easy to identify who went to med school. Doc, great stuff as always. We look forward to it, and we'll pick up that Accutane question next week, amongst other things in the news.
You got it. We'll talk soon.
All right, thanks.
Thanks, Dr. Most.